go ahead and do a trach suctioning on this patient. This will be an open suctioning, so what we want to do first is do our usual, come in, introduce ourselves, perform hand hygiene and don gloves, get our two patient identifiers, ask our patient if they have any allergies, and explain the procedure to the patient and ask them if they have any questions. At this time, we also want to make sure that our oxygen works, that we have the necessary supplies, which is the suction and canister. And we also want to assess our patient, check their oxygenation levels, and just do regular vital signs. Then what we'll do is we'll go ahead and lift the bed to an appropriate working position, and we will lower the side roll and go ahead and get started. So what we want to do before doing anything is hyperoxygenate our patient, so do that for a second. And then once it's oxygenated, we'll drop it down. If they had anything around their trach, like additional oxygenation, we can go ahead and leave that here to have continuous flow of air. So at this time, we're going to go ahead and again perform hand hygiene. Set up our sterile field. Pretend this is saline. Go ahead and open this up. Don our gloves. Our hands are sterile. And usually our kit comes with this little box here. So we'll go ahead and open that up in our sterile field. Put that here. Now what we want to do is we want to go ahead and grab the catheter. Kind of just wrap it around to give us some sort of control. That way we are able to hold on to the grip of this. Then with our non-dominant hand, we'll go ahead and grab some saline, pour it into our little cup, making this hand no longer sterile. And what we want to do is with our non-dominant hand, we want to grab this and connect these together, making sure only to touch the pink part with our dominant hand and not the blue because it's contaminated. So then what we want to do is, like I said, we're going to go ahead and remove the additional oxygenation, and keep it here so that way they're able to still receive continuous airflow. And then what we want to do is, with this non-dominant hand, we'll go ahead and provide suction, make sure that it's working. And to check it, we can always grab some normal saline in order to make it patent. And we'll go ahead and get started. So we're going to go ahead and insert up until we feel resistance or until the patient coughs. And then we're going to provide intermittent suctioning and twist the catheter. We want to do this for no more than 10 seconds. So we'll go ahead and do that. And then we'll remove slowly. And then when we do this, we'll go ahead and with our non-dominant hand, give our patient that air again to give them a little bit of a break and to resaturate them. And then at this time, we'll go ahead and clean any mucus in the tubing by suctioning in some more saline. Once that's finished, then we'll go ahead and wait a few seconds, maybe give them between 30 to 60 seconds, and then we'll go ahead and do it once more. So move the ventilation out of the way, go ahead and insert until we meet resistance. Do it for about 10 seconds and provide continued intermittent suctioning, and then remove slowly. Reoxygenate our patient and clear out any secretions. So this is very important to do, so that way our patient is able to breathe better and they don't feel like they're choking on their mucus or any other secretions. So we don't want to do this more than 3 times, so just be very cautious of that, and always remember to oxygenate your patient throughout the process. Once this is finished, then we'll go ahead and discard of our materials. Make sure to keep this around for our next time. Then we'll doff our gloves. We'll go ahead and lower the bed. And then we'll raise our side rails and then ask the patient if there's anything else we can do for them and then exit the room.